Hello, my name is Dr. Uloko. I'm a board-certified urologist that specializes in sexual health for all genders, a complex pelvic pain specialist, and a recurrent urinary tract infection specialist. What could it be when it is not a UTI? So many people come to the doctor or the urgent care or the ER with symptoms that feel like a UTI because it burns when they pee. There's urgency, there's frequency, there's sometimes blood, they get some lower abdominal cramping. So many people say, how is it that I am having these symptoms and yet it's not an infection? There are so many other things that can mimic a UTI, especially when it comes to the vulva. The vulva is part of the bladder. The bladder is part of the vulva. And so there are a lot of inflammatory conditions or muscle issues that can impact the vulva that can then feel like a UTI. It's actually a sign of an inflammatory condition related to the vulva, which is all regulated by hormones. And there are so many medications, so many life stages, so many disease states that can mimic a urinary tract infection caused by some sort of vulvar dysfunction, whether that is an inflammatory dysfunction caused by a loss of very important hormones, or a muscle condition or nerve condition. I see so many people that are constantly in that cycle of antibiotic, symptom antibiotic, but my goal in our research and our work in Vulva AI, what our goal is to break you out of that cycle. Your symptoms are very much real. Unfortunately, doctors are really just taught kind of a couple of things that it could be, whether it's a yeast infection or a UTI, when in actuality, if you have a really robust toolbox, you should have a whole plethora of things to potentially diagnose and potentially treat.